Hi, my name is Ashley Kunke, and I'm going to demonstrate IV insertion for nursing students. By the end of this demo, students will analyze how to insert an IV. First, we're going to gather our supplies. So we're going to need an IV start kit, a ChloraPrep to cleanse the skin, a tourniquet, a dressing to cover the site, a flush, and Co-band to cover when we remove the IV. So before we even get started with the IV, we're going to double check that we have a physician order. Although it's standard procedure to insert an IV for a colonoscopy, we still need to be sure that the provider ordered it. So I've done that and I've confirmed that Mr. Smith does in fact have an order for an IV. Next, we're gonna go to the patient and introduce ourselves. So first, hand hygiene always. Good morning, Mr. Smith. I understand we need to get an IV started. Could you tell me, please, your full name and your birthday? Mr. Smith tells us his full name and his birthday. Mr. Smith, do you have any allergies to medications? Mr. Smith denies any allergies. Okay, Mr. Smith, I'm going to get an IV started for your procedure. So we want to check the proper site. There's a lot of options to inserting an IV. In procedures, we prefer either the AC or the hand. The hand is an easy place to get to the IV site. So I've performed hand hygiene, I've put my gloves on, and now I'm going to put the tourniquet on and look for an IV site. All right, so Mr. Smith, is it okay if I put the IV in your hand? Mr. Smith says that's okay. I found a good vein. I feel the pulse. It's nice and juicy, good site. So I'm going to open up my IV start kit and get my supplies ready. One of the things about these IV start kits is the ports are not on very solid. So I have my flush ready. I always check that the sheath isn't too stuck on there and everything is moving okay. So I've put the tourniquet on. I'm going to prep the site. Mr. Smith, I'm just going to prep the IV site. This is just an antiseptic to make sure everything's clean. Let that dry for 10 seconds. While that's drying, one of my own processes is I like to have my dressing ready. So I open that up. I put it close to me so that the sticky side is up. All right, so the site is dry. I've chosen a hand in the vein. I like to position the hand straight, kind of flex it. For me, I feel like that holds the vein in place. So I've got my IV ready to go. Mr. Smith, you're going to feel just a little poke. Insert the cannula into the vein. I see a nice flash there. So I'm going to secure the cannula and remove the needle. Well, since I've gotten a flash, personally, I like to cover my IV site to secure it while I'm flushing. Just going to add that port on, and at the same time I'm going to make sure the other port is secure. All right, Mr. Smith, you're just going to feel a little bit of a cold fluid. This is not medication, it's just a saline flush to ensure that the vein is patent. So I'm flushing. Any pain or discomfort, Mr. Smith? He denies. All right, looks like we got a good IV site. I chose a 22 gauge because for this procedure, we only need this to infuse fluids and medications for sedation. It's not going to be a long-term IV. It'll be removed at the end of the procedure. Mr. Smith, does everything feel okay? Mr. Smith says the IV is fine. So to make things easier for the post-procedure nurse, I just lay out a gauze and some Co-band on the mail stand. The patient comes back into this room. So that's all set for the post nurse. I'm going to clean up all of my supplies, make sure I put the needle in the sharps container. So I've gathered up all my supplies and removed them. I've let the pre-op nurse know that the IV is in place. He's got a 22 gauge in the right hand. So flushed well, in place. We're good to go for our procedure. Thanks so much.